Hello my friends, today we will see why it is difficult to satisfy each and every patient at all the times. Did you face this kind of dilemma in your practice that you are not able to satisfy one particular patient throughout his treatment? Let us see how this situation is occurring. Friends, I am Dr. Anil Nirale, founder director of Happy Doctor Foundation, and I am cosmetic and plastic surgeon by profession and PGD BA in brand management by my passion. In my practice, I have come across with few such patients, and today I am going to share my experience with you. That's all. See now, as a plastic surgeon, we get various cases of diabetic foot. Now, to manage a diabetic foot, there is a standard protocol. Whether you are plastic surgeon or whether you are general surgeon or whether you are orthopedic surgeon, management of diabetic foot is that way very simple. Now, about 3 years ago, I had one patient of severe diabetic foot. 3 years ago, when the patient came to my clinic, I did examination, routine investigations, special investigations, X-ray and everything. Definitely the reports were high and I admitted the patient in hospital, did debridement, and after about 8 to 10 days, patient was alright and sent home. He was advised follow every 15 days and initially follow up every 7 days. But patient didn't come for follow-up. Patient came again after 6 months. Once he was discharged, he came only once, and then directly after 6 months with repeat infection and repeat diabetic foot. Then what? The whole cycle was repeated again. Blood checking, X-ray, hospital admission, treatment and discharge. See, in diabetic foot, you never jump to amputation in first sitting or even in second sitting, unless it is detrimental to foot. You always do conservative surgery, and I am sure whether you are orthopedic surgeon or general surgeon or plastic surgeon, you must be following same principles. Now again the same thing happened after 5 months. So this was the third episode. Then so the patient is not coming for regular follow-up. After discharge, patient comes for only one dressing, and when I tell them to come for regular dressing, they don't come. But when the diabetic foot condition deteriorates, then they turn up. So this happened for 5 times. First I saw the patient 3 years ago, and then it happened on 5 occasions. Now, when on the 5th occasion the patient was admitted, that time patient and their relatives and their some family friends who were knowing some doctors, even they had come in the picture. Okay. Now, what the patient is saying, I will tell you patient's perspective, how the patient is looking at my treatment. I am sure this episode must have happened with many of you. So, what the patient is saying, in plain simple language, I will tell you what patient is saying. Friends, patient is saying, my blood sugar is absolutely normal when I am at my home. My blood sugar is absolutely normal when I am at home. But whenever I visit Dr. Anil Nirale's clinic, and he tells me to do blood sugar, and in his clinic my reports come heavy, more than 400, more than 450. At my home I am alright. Whenever I visit Dr. Anil Nirale's clinic, my blood reports come normal. So, it was as if patient is blaming me that I am writing his report that blood sugar is 450, blood sugar is 550. I am typing the report. See now, where is the point? patient is looking at doctor and doctor's treatment in this manner, that doctor is bound to admit me in the hospital and extract money from me. That's what is the lookout of the patient. That's what this patient and his family members told other doctor, and the other doctor came to inquiry as a third party judge that patient is being followed for 3 years with you, still he is not better, and every time you are admitting and operating. What is this? Now here is the fault. The fault may be in me, that I am not able to explain properly to the patient that you need follow-up. You need follow-up 2 times in a week. You need follow-up once in a week, and you need to do blood sugar every week. Probably I might not have stressed it and the patient might not have understood it. Or the patient is just playing tricks. What is happening? What is the reality? It's very difficult to judge. This is what is the dilemma of doctor-patient relationship. The trust in doctor and doctor's trust in patient, doctor's trust in patient's relatives, and doctor's trust in the referring doctor. See, all these parameters are very important. And friends, keep it in mind that days are not far when the patient will come with a lawyer in your clinic. So, I am just sharing this particular experience. What is to be learned from this particular video or this particular experience sharing, that you have to decide. I am no one to decide. But I will tell you only one thing. If you want to know more insights about doctor-patient relationship, then do subscribe to our Happy Doctor Foundation YouTube channel, Facebook group and Telegram group. How you can subscribe and how you can become member of Happy Doctor Foundation, the link is there in the description box. So friends, keep in touch and stay safe. Thank you.